So I am so excited to introduce you to Caleb Wills. And Caleb is with Galt Advocacy, and they do a lot of great work, especially with IHSS, in-home support services. And I know for my clients, questions come up a lot about IHSS. So I thought, let's hear it from the horse's mouth. Let's go directly to the source of somebody who works with IHSS situations all the time. So Caleb, let me pass it over to you. Can you tell us just a little bit about the work that you do and maybe just give us an overview of what is IHSS?
Certainly. Well, thank you, Ellen, for having me on today and providing some education on, IHSS, which is a big program that a lot of people want to learn more about. So yeah, I specialize as an advocate, particularly with this program. And so IHSS is a social service that is through Medi-Cal. So in order for you to obtain IHSS, you do have to have Medi-Cal. And so for a lot of families who struggle with getting Medi-Cal financially, if you are raising a child with special needs, they can get Medi-Cal approved through a waiver with the regional center. But aside from that, IHSS starts with Medi-Cal. It comes from the same, bucket of money. And so with IHSS, kind of what is it in a nutshell? It's a social service that pays somebody, or it allows somebody to hire a caregiver where they're paid through Medi-Cal. That way, if you are disabled yourself, you don't have to be paying out of pocket for those types of needs. And there's no age restriction. Anybody can have IHSS at any age. So if it's a young child, we oftentimes see that with little kiddos with autism or Down syndrome, cerebral palsy, where the parent is doing a heck of a lot more than the typical parental obligations, right? And so if that seems to be the case for a lot of special needs families. And so with that said, IHSS can bridge that gap financially for you. So if you yourself as a parent, or you are the loved one of somebody who's disabled or has special needs, you would be paid by this program not to be their parent, not to be their loved one that's helping them, but as a caregiver through this program. And that can range from a few dollars a month to several $1,000s a month. And so that's kind of IHSS in a very compact nutshell.
Excellent. Oh, that's great. Now, so how do they determine whether you get several dollars a month or several $1,000s a month? What process do they go through?
So they go through an assessment process when you apply, and how to apply. You can do that by phone. You can call your local IHSS office in your area. You can go to the office and fill it out in person. You can fax it over. You can print out an application online. But you start with an application, and from there, they will assign a social worker from IHSS to come to your home. And that person's usually there for about an hour, and they're talking with you about the needs that are requiring support in that home. And so this is a category-based benefit program that pays by the hour. So they're going to go into all these different categories of this person's life. They're traditional ADLs, which are the activities of daily living, the routine care, bathing, dressing, using the restroom, all of that. And then there's the paramedical side. So anything that's intrusive or medical in nature, you can be assessed for that area as well. And then, of course, protective supervision, which is one of the big things that we talk often about with a lot of our families, which is that part of the benefit is reserved for those who can't be left unsupervised. Whether it's a child or an elderly person with dementia, if cognitively they can't keep themselves safe, they don't have that judgment, then protective supervision is something they could be assessed for. But how they determine this is all based on need. So the more the need is, the more time you get for each of those categories. So they go into each category and assess it individually. 5 minutes a day in this category, 10 minutes a day in that category. So at the end of the month, there's a specific amount of time allotted that you can, as the caregiver, you'd be putting on a time card, just like a regular job, and you would be paid for those hours. So the need that is there is going to determine the level of hours. So the higher the need, the higher amount of hours you get, which then in turn pays you more because you'd be clocking more hours on a monthly basis.
Nice. So I assume, as you're going through this assessment, as parents, right? I have a child with special needs myself. My instinct is to paint my child as wonderful as possible, right? But I assume during this assessment process, you don't want to do that, right? I mean, you want to kind of depict them on their worst day. Is that right?
That's really true. Yeah. Without really nitpicking the benefit and the social workers, focusing on, I guess, some tips for a lot of parents, specifically parents, really. Yeah, in every area of your child's life, you want to celebrate them. You want to talk about their victories and talk about how much progress you have in all these different areas. But when it comes to that home assessment with your social worker, you got to have a different mindset. I often will say this: You don't want to look at this as you're trying to help your child. You're looking at this as your client. This is your patient that you care for. And in order for you to get the appropriate amount of hours with this program for your patient, you have to talk about their worst days, like you just said. And so, yes, by focusing on what they can't do rather than what they can do will help you with getting a more accurate amount of hours granted through the program.
That definitely makes sense. Now, do you have to have some sort of written caregiver's agreement when you enter into this, or is it just you sign up for IHSS and that's sufficient?
Yeah, so you do have to go through a background check. You have to go through an orientation to become a provider. It's pretty straightforward. It's not rigorous. The social worker at the time of the assessment can give you the provider enrollment paperwork. That's what that's called, provider enrollment. And so anybody can be the provider. If you're the parent and you want to be the one that's clocking the hours every month, then you would sign up to be a parent provider. And again, what that looks like is you would fill out the background form paperwork and return that to the local live scan office in your area, which could be a FedEx, could be UPS. They'll do your fingerprints there. And then after some time, some counties, it's a couple of weeks. In other counties, it could be several months, but eventually you'll get that word back from the background people saying that you're good to go. And once that's done, usually at that point, you're going through an orientation through the county. The orientations can be online, they can be in person, but the purpose of those orientations is to teach you what the program is, how it works, your responsibility as a provider, how to avoid fraud. You don't want to clock more hours than the person's actually approved for, things like that.
Nice. So now at Galt Advocacy, I'm wondering, because there's kind of we're talking about the eligibility and application process. And then I'm also thinking about once you're in, what are some challenges that can come up where they might try to take away some of your hours or other things? And what do you guys do as advocates?
So as advocates, we like to refer to ourselves as the red pill takers. We've seen kind of a dark cloud in the world of special needs. And that comes from the personal experience of Myra Galt, the founder of Galt Advocacy, who had her own struggles, her trials through trying to get into these programs. And she realized that at the end of the day, no one's going to really care about you. No one's going to care about your special needs child. And they're pressured. These programs are pressured to limit the benefits. And so that can sometimes cloud their ability to appropriately assess. And so these social workers, they're not like trained psychologists. They're not the same type of social worker you'd find with CPS or foster care. They're more like auditors for the county. And so they don't typically have training on something like autism if you're applying for your autistic child, or again, if you have an elderly parent with dementia. They're not doctors, they're not psychologists who maybe recognize and understand those limitations. And so their only basis is on their training. And unfortunately, the training, when we look at it, it's not always going to be what we agree with. And so it can tend to really limit the amount of hours per month you can get at times. And so for us as advocates, we do have experience personally and professionally working in the special needs world and the disability world with, again, young children and the elderly. And so we understand that when it comes to working with IHSS and dealing with the social workers, it comes down to several factors. You have to know what to say and what not to say. Obviously, you don't want to lie, but there are some things that you don't have to share with them, because those things could impact your ability to get more hours with the program. And the program itself, these social workers, they have an expectation of coming to your home every single year for a reevaluation. And they're going to want to see, how has this person improved? Do they still need this, right? And so there is a lot of pressure from the county for these social workers to really encourage the families to get off the program. And so that's kind of the challenging things that we deal with our families. And that's what people use us for, is to protect that from happening. It's to help advocate for them so that they're not convinced to wrongfully walk away from the program or wrongfully get their hours ripped away. Not every social worker is perfect, and some social workers are pressured more so than others to remove the benefit, even when it really does need to stay intact. So we offer representation through that process, whether it be to apply, informal representation. If you have to appeal the benefit, go in front of a judge, we can help you with that. If you need help with just your yearly assessments, maybe you have it all set up, you're good to go, you did it, you got everything approved, you just want help kind of maintaining it, we also can support you in that as well. And so that's kind of where Galt Advocacy would come into play.
Wow, that's an incredible service that you guys do, I have to say. I mean, usually when clients come into our office, they already have their public benefits set, or they're looking into them, and we'll send them to somebody like you guys, because we don't do the public benefits applications. But I'm so glad that you really focus in and specialize on that, because that is paying for somebody to be able to stay at home and take care of their kid. Now, for IHSS, can you hire a provider outside of the home, and can you supplement what they're receiving?
That's a very good question. We do get that one often. The rules have changed quite a bit, especially recently. But as it stands right now, yes, you can pretty much hire anybody to be the person's provider. Typically, in a minor's home, if the minor is the IHSS recipient because they have special needs or they have a disability, they will encourage the parent to be the provider, which it makes the most sense most of the time because the parent's usually the one providing most of the care, right? But in some situations where parents work full time and they would like to have a caregiver come into the home, that's totally okay. There's, some things you have to do to kind of make that happen. But yes, basically anybody can be a provider for for a recipient with IHSS at this time. They just have to go through that application process and background check. And as long as they go through that, they can be the provider for that person.
Okay, terrific. Now, what about, they don't pay a lot though. What about supplementing what they get paid?
Yeah, so that is going to be between you and your caregiver. What IHSS does not like is they don't want you to be paid the hours where you're the one claiming them. You're the one stating if this child's approved for 200 hours per month and you're the one providing this 200 hours a month, they don't want you to get paid that and then use that money to pay a caregiver to come in at other times. However, if you do have a caregiver who's coming in and they're the ones claiming the 200 hours a month, that is up to you. If you want to have some type of agreement with them to pay them for additional support, that is on you. So again, legally, I don't know the ramifications of what that looks like, paying somebody under the table or if you have a formal agreement set up. But I do know a lot of families do have something worked out with their caregiver so that they can make a little bit more income than what IHSS is paying. And there's also other ways to do that as well with other programs where, if you have a child that requires, or even an adult who has special needs or disabilities, there's things outside of IHSS that you can also blend in there with that might, help bridge that gap you're looking for financially.
Wonderful. Well, thank you so much, Caleb, for your succinct yet powerful information. So if somebody wants to reach out to you, they think, hey, we could really use Galt Advocacy services, how would they get in touch with you?
Well, thank you, by the way, Ellen, for even having me on and kind words. I appreciate it. I would actually recommend that they follow us on Facebook before you reach out to us. Get to know us a little bit. It's hard when you're caring for somebody with special needs or somebody who's disabled. You're constantly dealing with strangers to help you in many different ways. And so we don't want to be just another stranger in your life. We want you to see us as people who are in this world personally and professionally. I share my background a lot on our Facebook page, Galt Advocacy, where I go live every Friday at 12. My history is I come from the world of special needs. I have multiple siblings with special needs, and IHSS is what put food on my table growing up as a child. And that's why I know so much about it today. That's why my family runs Galt Advocacy. Yeah, I would recommend that you check us out on our website, galtadvocacy.com, or go on our Facebook and watch some of our streams. We save all of our streams, so you can go back and watch the ones that we've done for the past 4 years now. Get to know us a little bit, and then if what we say strikes a chord with you and kind of what you're dealing with in your home, then give us a call. Call us, get on my calendar for a consultation or just a chat. We'd be thrilled and honored to speak with you if you thought that we might be able to help you.
That sounds great. Wonderful. Well, thanks so much, Caleb. I really appreciate your time.
Of course. Thank you, Ellen.
Hello, everyone. If you liked my mom's video, don't forget to like and subscribe. See you all next time.